Hello, welcome to Read Scholars Live. I'm your host, Dr. Mary Fleming, and current president of Read Scholars. Today, I am super excited to have with me Dr. Muyibat Adelani, a former classmate of mine when we were in medical training back in Nashville, and currently an orthopedic surgeon in the St. Louis area. How are you?
I am good. How are you?
Good, good. The day finds you well?
It does. We just had a big snowstorm, so just recovered from that.
Yeah, I'm in Kentucky today, and we got a party that not like y'all's though. So,
Mm.
so you know you've done quite a bit since we parted ways in Nashville a little bit ago. So, start off and just tell us, what took you to medicine, why orthopedic surgery. Tell us a little bit about your journey.
Sure. So I grew up in St. Louis. And I actually wanted to be an accountant for most of my life. But then I realized that I
Oh,
really wanted
Jesus.
to stay, exactly. I really wanted to stay connected to people. And I didn't feel like accounting would do that. So that's what kind of took me to medicine. I felt like, what better way to be intimately connected to other people than to help them with their health. Um, and once I got into medical school, I got really interested in orthopedics because I was really interested in function. How do we keep people moving? How do we keep people able to do all of the things that we need to do? Um, so that's why I became a joint replacement surgeon. So, like you said, I did med school with you in Nashville, and then I did my residency here in St. Louis. I did a joints fellowship at Stanford, and I've been in practice in the St. Louis area for going on 8 years.
Wow. Yeah, I remember when we started having those conversations about being an orthopedic surgeon, and I was like, a better woman than I. I couldn't handle it. So super proud of you for sticking to it. And that the surgery world has its own challenges. And definitely as a woman, as a Black woman, of course, I know that you've probably gone through some things. Um, and we were even in medical school, had lots of conversations around health equity and diversity inclusion. And I worked on some projects together. And I think that's always been a passion of each of ours. So today, I thought we'd talk a little bit about how that conversation has kind of changed since we started having it a little while ago. Like what did it mean for diversity and inclusion in the academic space, like when we were there, versus what does it mean for workforce development, versus what does it really mean about impacts on health equity in the healthcare space as a long run. So no, that was a whole bunch, but I'll give that to you to kind of dissect and talk about what do you think about the evolution of the conversation and the vocabulary, and what does it really mean for impact and change?
Yeah, so I think, when we first started having these conversations, it was only about diversity, right? How many people of color can we get here? Exactly. But once we got there, it was as if nobody had thought about the next step, right? How do we, now that we've brought these people to the table, how are they going to relate to the people who've always been here? And what's that experience going to be like for them? I think that's the biggest thing that's evolved, right? So it used to be called, diversity work. And then they added diversity and inclusion. And then equity was kind of added later, right? So you have DEI now. I think there is a growing recognition of it's not just getting people present, but also keeping them engaged and influential in the work of whatever organization it is.
Yeah, and now there's the JEDI, right? Justice, equity, diversity, and inclusion. There's belonging gets thrown into those conversations some too now. And we've also talked about retention, to your point, like we get you here, and then what, right? Some of the, if the environment was not built to be inclusive, to not give you a sense of belonging, then you don't want to stay. So really your point is like you diversified this particular group, but you're not going to have any long-term effects of actually making change because you didn't create an environment in which those people wanted to stay. And so, it's constant evolution and battle of like where we are, how do we fix it? And to your point, and making it not just a talking point, making it an actionable point, because the point is that we want to create a space that everyone can thrive and achieve and have their healthiest and best outcomes as possible. So thinking about that, what are your thoughts on making this more actionable and not just, what do we call it? Not just talking points.
I think the key to it being actionable is the people in charge have to want it, right? So we can want it all we want. We want to be at the table. We want to be influential. We want to have a voice. But if nobody else, or particularly the people at the top, don't want that, it really doesn't matter. It gets nowhere. You get stuck there, right? And then that's compounded by the fact that there's essentially no accountability for that, right? So at the institutional level, you're allowed to have these conversations about diversity, but nobody ever says, what does success look like and what happens if you're not successful, right? Like, so leaders get held accountable for everything else, but diversity gets to just be this talking point. And if you fail in retention, or if you fail in inclusion, nothing really happens.
And, we've had this conversation on this podcast and outside of it. So, within, whether it was all COVID, but especially within this last COVID couple years, and really talking about the social justice issues from George Floyd and Breonna Taylor, and people being more somehow just aware that there's these health equity issues that have been there all along. Like, this is not a new thing. But, people are aware, and we have all this explosion in kind of the corporate space. Like, everybody wants a DEI office. And a lot of these offices are one person, right? They're not truly an office, right? And to your point, like, it's just kind of for show. So, what my concern is, to your point, if they're not held accountable, then if they fail, it was like, well, that one person came in and, we hired that person and they didn't fix it, right? But it's not a one person, to your point, it's not a one person problem. It's everybody's problem. It's the organizational's problem. And so talk with me about, we were talking about some of the policy issues, like how do you encourage change on a level that forces behavioral action? What are anything that you can think of around like local policy, government policy on all levels, and even, we often think about these government policies. They have to be huge federal policies, right? But some of our policies are at the office level, right? Some of our policies at the hospital level, at the education, the school system level, right? This is why we always talk about getting involved in your local PTA and school board votes, because that really influences change as well. So what are your thoughts on where are major points of impact for policy change that aren't these overarching federal regulations?
Yeah, I think the first step is probably institutional, to your point, right? That's where each of us has influence. That's where our home base is. So I think that would be the logical place to start. I think a lot of the problem comes from your earlier point of we want diversity is an optic and not an action. So if you want diversity, then you have to go through and say, what got us here? What are the policies that are existing that are holding us back? What are the things that are missing that would help this along? And then you have to implement those. And you have to hold the people accountable. What tends to happen is it happens really softly. This is something we want. This is something we would encourage you to do, right? And then the lower level leadership, whether that's department chairs, managers, whatever kind of organization it is, get to decide. They get to opt into equity. And that shouldn't be the case. It should be required from the top down and held accountable. I think there's a lot of different policies or categories of policies that we could think about, especially in the healthcare workspace, right? Some of these have to do with just discrimination, bullying, and harassment. If people report those things, how is that managed? If ultimately it becomes on the person, oh, we're sorry that happened, and Johnny didn't mean it. You can't continue to live like that, right? Like there has to be some level of accountability, but there also have to be policies on the way you operate your business. So in the healthcare space, if we talk about diversity, then we have to treat our minority physicians, female physicians, the same way as everybody else, allow them to grow in the same ways that everybody else, allow them to function in the same ways that everybody else. And what tends to happen is those individuals get put into some sort of box, right? There's no policy against that. There is no way to hold anyone accountable for supporting your career or for not supporting your career for that matter. So people kind of get left behind, even though they are quote unquote diverse institution and quote unquote inclusive. You have to start getting into the weeds and saying, where are the real disparities here?
Yeah, I had a conversation with one of my friends who's also a guest on the podcast, and she's a lawyer, and talking about kind of the mentorship and sponsorship pathway through your professional journey. And I think that's kind of what you're speaking to there. So you can bring a person in, give them task, and then if you don't support them and they fail at the task, then it's their fault as an individual. Versus person B came in, probably got the same task, but also got a mentor, a sponsor, has the maybe family legacy that their, grandparent was also a physician here, another professional here. And so the playing field is not really equal, but yet you expect them to perform at the same rate. And if this person fails, then, well, this is why, what's the point of this diversity thing anyway, right? Clearly they can't handle it, or clearly whatever it is going to be at the level of an individual. And that's not fair, right? And nobody wants to dive deep into that. It's like, it's very dismissive. And as opposed to how do we build an organization where everyone can thrive regardless of where their background is, which is the whole point of like equity conversations, right? Match resources to the people, not try to make everybody function the same with the resources that they've been given. So
I think the other side of that though is we've got to start acknowledging some of the uglier things that happen in these workplaces, right? Like, so it's one thing to not have resources, but we also need to acknowledge that there is career sabotage, right? There are roadblocks that are intentionally placed in front of people when they are on that pathway to success. That holds them back too. Like there is a component of intentionality that happens with these things. And I feel like that's something that people don't want to talk about. It's kind of just the ugly truth that is behind that door, right? A lot of us know that that's true, but it's, we're trying to have this conversation in abstract. To your point, we've got to get into the real details. Is it that, they weren't ever given the resources in the first place? Or did they have the resources and then there were other blocks that were put in place that prevented their success?
Yeah, I don't think we want to talk about it. It's interesting as kind of thinking about another, we think about health equity in the healthcare space, right? Well, we know that's not actually where it lives. But a current event that's happening right now is the conversation in the NFL, right? And those are some of those ugly truths that people don't want to talk about. Like, it's not just, to your point, everybody wasn't given the same opportunity. There were things that were done intentionally that can influence or stunt or derail somebody's career. And those things have been going on unchecked for a long time. And when people are called on it, then, they want to deny or escape or elude, whatever word you want to use, that these very real things are happening that are not allowing people to live their best lives or fulfill their career obligations compared to the next person. The other thing I was kind of thinking we could touch on is we talked a little bit about implicit bias, what that means. and creating behavioral change in institutions, which is kind of what we've been talking about. What are your thoughts on where does that truly, how do we truly take the next best step, right? So if you are, Johnny Sue in St. Louis, Missouri, and you're, working, we're physicians, so working as a physician, and you see something that, you're like, I know that there's something not right about the people, the patients that we're choosing to serve, the location that we're choosing to serve. We're creating inequities in our local surroundings. What do you think the next best step is around behavioral change for those types of environments?
I think the first next step is to challenge it. People see these things and you question them. Some of us fully understand what's happening,
Yeah.
right? But the next step is to actually call it out. It's similar to, what we've talked about with police murder and things like that, where it's like, well, why does this keep happening? Well, because there's no accountability, right? Nobody ever goes to jail for it. Nobody ever is punished for it. Therefore, it will continue to happen. It's the same thing here. It's like when you create these situations in the way you run your practice that are having consequences on certain populations, and it doesn't ever get called out, of course it's going to continue.
So, can we, as we get to a close, what do you see on the horizon for you? What is in your future? What are you looking forward to as you kind of continue to grow and craft your career?
Yeah, I think that, the next phase of my career hopefully will be supporting other physicians of color. I think that we get brought into an environment and then you get to see what really happens, right? And it can be very jarring for many of us and very difficult to manage on a personal level. I don't think that people as a whole understand how personal health inequity can be for physicians of color. And I think that takes a toll on us, and we've got to figure out how to manage this better, because if we're not healthy, if we're not in a healthy space, we can't do our best work. And I want all of us to be able to do our best work, but I don't think we should be driven crazy in the process. Yeah. So yes, we want to help change the system, but we also have to help support ourselves and do what's right for ourselves as well.
Indeed. And that just made me think about kind of when the Black Lives Matter movement was evolving, and going to, I was working sometimes very rural places in America. So there's not a whole lot of people who look like us there, and listening to the conversations in the background about, challenging the Black Lives Matter movement in a whole. And I remember pushing back on somebody and like, does that mean I don't matter? I'm a Black life, right? And so I think they forget, or there are groups of people who forget that, yes, we are working towards health equity in the global sense, but it's also us working for ourselves and our parents and our brothers and sisters, right? Like, this is personal. Yes. And we want to take care of everybody to the best of our ability, but we bring all that to work with us, generally speaking, for the greater good, right? That makes us, empathetic and well-rounded and able to care for a broad base of patients and that type of thing. But it also makes it a heavy day some days, especially when we're at work with people who don't necessarily share their same vision. So I'm glad you brought that up. I appreciate that. Any pearls, words of wisdom you want to leave for those who are entering the space, or maybe have been in the space for a while and might be getting a little tired and frustrated? What's your motivating words that you would leave us to support those who are doing the work?
I think that the first is, just because somebody else doesn't acknowledge the work or even respond to the work doesn't mean that the work isn't important. I think that we get so stuck against brick walls at times that we want to give up and say, well, maybe this isn't a worthy cause. But the worth of the cause is not necessarily dictated by the opposition, right? We are fighting for people who generally don't have a voice in the healthcare space and maybe even the global space, right? Because we all know that health is political. I think that that's the first thing is don't judge the worth of your work based on other people's responses to it. And then the second thing I would say is that make sure that you have the support that you need personally to continue doing the work that you're doing. I think that medicine as a culture creates this kind of martyrdom where you're supposed to give your whole self up for this cause. And we don't acknowledge what that cost is, right? We kind of assume healthcare workers are these kind of superhuman, heroic beings, but we're just regular humans. We're not impervious to what happens around us. Things that are big and small impact us just like regular people. So I think we've really got to do that work to maintain ourselves in the process, because otherwise I fear that we will reach a point of burnout. I mean, I reached that point of burnout, and I think that globally, if a lot of us reach that point, we're in for some real trouble.
Yeah, I agree. So we'll come back and have a whole nother conversation about that. But I'm going to conclude, because you just dropped a whole word, and I'm going to let that sit and let that sink in with people, because I think those are great things to think about. And it's important, especially always, but especially in these past few years, self-care is so very important. And, if we're not taking care of ourselves, we're not there to take care of other people. So very important. But with that, thank you so much. So great to see you. So proud of you and all the things that you are doing. Definitely keep us posted. I'm hoping you'll come back and maybe do a round 2 with us in the future.
Yeah, I would love to come back. Thank you for having me.
Of course. Thank you for listening to Read Scholars Live. Please follow us on Facebook, Twitter, or Instagram, or subscribe to our YouTube channel.